We're going to talk to you about co-payments and patient charges and how this is part of the narrative to dismantle and replace the NHS with an insurance-based system. What do you think, Sarah?
Well, I think that what we're seeing, what we fear is happening, is a complete betrayal of the principles on which the NHS was founded. The NHS was established in 1948 in the post-war period, when the country was broke. And it was set up as a universal healthcare system, care from the cradle to the grave, funded through general taxation. And over the past 3 decades, we've seen an utter betrayal of that principle.
Yeah, we've seen how at the beginning in 1948, everything was covered, like dental care, eye care, and all your medical care. But gradually we've lost a lot of dental care provision within the NHS. Eye care has been commercialised. We had the introduction of prescription charges very early on. And now we're getting more and more talk about how people need to be responsible for their own care. And if they have certain conditions or if they're overweight, you're getting this demonisation and the creation
Absolutely.
of the undeserving sick. And only last month there was a major elevation of this issue, I believe, by the local medical committee, which is a division of the BMA, and they voted at their national meeting to consider the introduction of co-payments. And to me, the alarm bell started ringing. This is a major step forward, isn't it?
It's a major step forward in the road to privatisation, because it makes payment for medical care acceptable for a population who hold the NHS in their hearts, who value it. The idea of paying for medical care was until very recently quite an alien concept. And as you say, this narrative of deserving and undeserving, which started largely with the debate around health tourism. Okay, so you had this idea about health tourism. The infrastructure to pay for medical care was then installed in our hospitals. So there are card machines in hospitals, there are case money in hospitals. So that's looking at particular patient groups. Who's next?
And by doing so, you've softened up the NHS staff for thinking about charging.
Yep.
You've softened up the public for making charging more palatable. But what people don't realise is the cheapest and most effective way to provide healthcare is through general taxation. You do not need a parallel administration to deal with charging and billing and starting up insurance. In fact, the NHS was ranked #1 in the developed world in terms of health systems because it was cost effective, it delivered good outcomes, and it was fair and everybody had access to it. But co-payments and patient charges, we know, are a zombie policy. That is, they lack evidence that they're effective, and they also put off the most needy, the poorest and the sickest. And this has a major effect on the rest of society.
It does indeed. Inequality in general, whether it's inequality in income, inequality in educational provision or inequality in healthcare, has a major impact on the whole of society. And whether you're at the top or the bottom of that society, we all need to live in a society which functions, which is cohesive and which looks after everybody. And again, this is one of the founding principles of the NHS. But what we've seen is that we've seen almost the perfect storm, and it's a manufactured storm where we have funding squeezes, particularly in the primary care sector. There's a major recruitment crisis in medicine in general, but particularly in general practice. There's also been an increased demand on general practice services because of hospital closures. And now we see that patients are being charged for certain GP services.
Well, this has been very cleverly crafted by government. I know as a GP, my practice has lost 20% of its funding in the last 3 years. My workload has gone up. More and more patients are bouncing out of hospital. More clinics are shutting, so that's more work for my practice. And I can see how colleagues have been made desperate in terms of, do they, allow their practice to fold, or do they look for other funding streams? And the BMA, unfortunately, have only presented this as the solution. And I believe we've been set up to fall into a trap whereby we will actually destroy the trust between the doctor and the patient. The patient will start to suspect, is the doctor giving me this advice because he can charge me for follow-up? So we are starting on a slippery slope of the collapse in trust amongst the public for doctors, as we saw in America when they went away from the community provision, the charitable provision, that was replaced by the commercialized predatory insurance market.
I am proposing today a new national health strategy. The purpose of this program is simply this. I want America to have the finest health care in the world, and I want every American to be able to have that care when he needs it.
The plan hatched between Nixon and Edgar Kaiser worked. In the ensuing years, patients were given less and less care.
I actually don't believe that the practice of ethical medicine is compatible with a privatized system such as you have in America. You will be providing care not on the basis of need, but on the basis of profit or what you're told to do. And we're actually seeing this erosion of doctor-patient relationship, but also of professionalism. Doctors are being told what to do more and more by managers and by profiteers.
Well, we know, and the study's been formed, that whenever you introduce the exchange of money between the doctor and the patient, this perverts behaviour. It also sets up the patient to be exploited, maybe get treatments that they don't need, or follow-ups that they don't need, or investigations that they don't need, because now there is a financial incentive for the doctor or the hospital to be performing and over-treating patients to their detriment, potentially.
Absolutely, and there's been a very high-profile case recently of this, and we'll be talking about that particular case. But there have been other problems highlighted, particularly after the 2012 Health and Social Care Act, and particularly with things like hip replacements, knee replacements. The outcomes are not as good in the private sector. And what they seek are quick, easy, profitable procedures on younger, healthier patients.
And done at lowest cost. So we have the example of cataract surgery performed at Musgrove Park Hospital by a company called Vanguard, and their complication rate was close to 50% when it should be less than 1%. And in the end, that their services had to be shut down. But the public and the patients are damaged, and the taxpayer is left to pick up the bill. So private provision is inherently potentially corrupt and also destroys the trust between doctor and patient, and is something that should be avoided.
Also, many of these services are being provided behind an NHS logo, so it further undermines public confidence in the National Health Service.
Yeah. Well, we'll be updating you with more, and we'll be coming back to the recent case of Ian Pattinson and discussing that further. Please go to our GoFundMe page, GoFundMe The Great NHS Heist, and support our film project, which will be going into a lot more detail about all these issues and tying them together and spelling out where we're headed, which is the American insurance system.